Welcome to Susan G. Komen, New Jersey's latest webinar featuring Dr. Denise Johnson Miller of Hackensack Meridian Health. My name is Michelle Cash. I'm the Director of Mission Events and Operations for Komen, New Jersey. Today, we'll be talking about taking care of your own breast health as we navigate this health crisis and our state's reopening. Our guest today, Dr. Denise Johnson Miller, is a board-certified general surgeon and is fellowship trained in surgical oncology. As a nationally recognized breast surgeon, she specializes in breast cancer, melanoma surgery, and soft tissue tumors. Dr. Johnson Miller is currently developing clinical translation trials in support of oncology drug testing, as well as an in-depth genetic testing program for multidisciplinary cancer risk screening in breast cancer. Dr. Johnson Miller is also a member of the National Accreditation Program for Breast Centers, NAPBC, Accreditation Committee for Hackensack Meridian Health, and holds high academic standing as a clinical professor of surgery at Seton Hall Medical School and clinical associate professor of surgery at Rutgers Medical School. Dr. Johnson Miller is interested in accelerated partial breast irradiation, autologous tissue flap breast reconstruction, and skin and nipple-sparing mastectomies. Dr. Johnson Miller is a frequent presenter at national conferences and regional meetings. Widely published in medical journals, she holds several memberships in professional organizations, including the American Society of Breast Surgeons, the Society of Surgical Oncology, and the American College of Surgeons. Thank you so much for being with us today, Dr. Johnson Miller.
It is my pleasure. Thank you for having me.
There seems to be so much confusion about what's open and what we should be doing to take care of our health. I guess the first question is, are doctors' offices and clinics open and making appointments for annual well visits and screening mammograms?
All of our imaging and diagnostic locations are open and taking the proper precautions to keep patients safe. If you delayed your annual screening mammogram due to COVID-19, it is so important for you to reschedule your appointments. Your well-being is not elective, and we believe in creating a safe environment where you can get proper care comfortably and confidently.
What, if any, changes should I expect when I visit the office, either for screening, diagnosis, or treatment of breast cancer?
We continue to provide the same breast care screening, diagnosis, and treatment options. We will continue to deliver the highest care to our patients. However, we have taken steps to ensure patient safety. If you are hesitant to seek person care in a facility, you have to know we are prepared. We have enhanced our processes to protect the safety of our patients, team members, and physicians, and have taken the following actions within our facilities: extensive cleaning, enforcement of social distancing and limiting schedules, patient screening and temperature monitoring, mandatory masking, and we have had to restrict visitation at Hackensack Meridian. We are requesting visits to the patient only. Family members can wait in their vehicle or perhaps in a public area. Everyone entering the office will have a temperature screening to ensure you do not have a temperature over 100.4 degrees Fahrenheit.
So if I'm not coming to a Hackensack Meridian facility, what questions should I ask to ensure I understand the safety measures in place in my doctor's office?
I would advise that you call and speak to the manager of the physician's office or to the physician himself or herself. These aren't statewide precautions, but I would ask what they are doing to sanitize as well as what other measures are in place. For example, do you need to wear a mask? How is social distancing enforced? Do you accept visitors as family members? These are the questions you should ask.
So if I'm a caregiver for an immunocompromised person, or I'm immunocompromised, is it safe for me to schedule my annual well visit or screening mammogram?
Absolutely. It is for almost everyone. Please schedule your annual well visits and screening mammograms. People with cancer, people who are also in active cancer treatment, older patients, and people with other serious chronic medical conditions such as lung disease, diabetes, or heart disease, may be at higher risk, and their immune systems may have to fight more and may develop more severe forms of COVID-19. If you are on certain medications that suppress your immune system, you are also at higher risk. The same rules apply for people with cancer as for those without cancer. Be sure to wash your hands well and wash them frequently. Avoid touching your face. Avoid close contact with people who are sick. And if you have any concerns, your doctor is the best person to help you make that decision.
That's great. Well, how about will I need to quarantine before or after my appointment?
As long as you have no symptoms of a temperature over 100.4, or certainly if you have not you've tested negative for the COVID-19 virus, you will not need to quarantine as long as you are healthy and have no symptoms.
Well, my annual mammogram was delayed or canceled due to the COVID crisis. Should I just skip this year and wait for 2021?
Well, you know what my answer is going to be. Your health is not elective and should not be put on hold. You should schedule your mammogram appointment as soon as possible. Physicians are very concerned about the possibility of some cancers not being detected until they're at a very late stage. And we want to encourage you to come in to keep up the screening schedule, even if your annual visit has been delayed.
Great. If I'm still nervous or I'm a caregiver for somebody who still isn't sure about going out for routine care, what steps should I take?
I think, again, I would call the provider's office, ask them to help you understand the steps they are taking to keep you safe. Make sure you're not sick when you go. Wear your mask and make sure that you ask about sanitation practices and screening questions. Medical offices have gone to great lengths to add safety procedures. At Hackensack Meridian, you're not waiting in a room with many people anymore. Most of the time, we ask you to wait in your vehicle, and our offices will text or call you when it is time for your appointment. And if you still have questions, the most reliable source of information is the Center for Disease Control and the New Jersey Health Department website for COVID-19.
That's great. That's great advice, Dr. Johnson Miller. Do you have any final thoughts to share?
Well, I say know before you go. Call your facility, know what their processes are so you know what to expect and how they expect you to stay safe. Continue to monitor your own health. Stay home if you or someone in your home is very ill. Don't delay if you don't have insurance or if you've lost insurance, because many facilities have funding to support screening for those at risk who are underserved, underinsured, or may have lost their employee directed insurance.
So ask the questions and don't delay. Thank you again, Dr. Johnson Miller. Finally, you're very welcome. Thanks for being here. Finally, a reminder that Komen, New Jersey's More Than Pink Walk is coming up on Sunday, October 4th. Given everything that is going on right now, we're planning to have plenty of options to participate virtually. Cancer doesn't take a break, and neither do we. Please register and join us to walk where you are to help us reach our goal of raising $650,000 towards the fight against breast cancer. We are especially grateful to our platinum sponsor, Hackensack Meridian Health System, for their support today and in so many different ways. Thank you for being here.